In this chapter, we'll be discussing the types of techniques and different devices and therapies used to better bronchial hygiene within the patients. And so, one of the first ones is directed cough. With myself, the RT, I would come in, wash my hands, and introduce myself to the patient, and have them sit up so they can get a better cough coming out of the diaphragm. Um, like I said, with bronchial hygiene, what we're looking for is clearance of the airway of any secretions or sputum. And so, like I said, I will have the patient sit up and take a deep breath and hold it for about 2 to 3 seconds, and then cough. And then once they cough, as the respiratory therapist, I will be looking for any sputum, the consistency, how thick it is, if it has a smell to it or not, and I would just be noting that down. And then a pillow after they get done coughing, just in case if they any post-operative patients or patients that might be in pain, the pillow can help them splint, to dumb down any little pain that they may have. And I forgot to mention that if the patient is uncomfortable sitting up or they can't sit up, you can also have them laying down on their side with their knees curled up. In fetal position, they have to be in fetal position. That way they can cough. And then you have the cough alternative. And then another therapy that us respiratory therapists use is the vibratory positive expiratory pressure therapy. And for that, we have about 4 devices, which is the flutter, the pep mask, therapep, and the acapella. Normally, the most common ones that may be used are the flutter and the pep mask, and maybe the therapep. With that would take the volume of their expiratory, and we would note it as a respiratory therapist. And then the other therapies or training that us respiratory therapists use is the inspiratory resistive muscle training for the patients as well.